I've been on active duty for the last 6 years. I'm a lieutenant colonel. This bracelet was made by a friend of mine, Miranda Green, and she's a medic in the military. She took parachute cord that came in a pink color and wove it into this bracelet. If you need a rope, you can use it for that too, but right now it just memorializes everything that I've gone through and the fight that I still have to get healthy again. I had always had mammograms because my mother had breast cancer when she was 35. So from the time I was 30 years old, I started having mammograms and doing self-breast exams. All of them were normal until in January of 2010, I found a lump underneath my arm. So I scheduled a biopsy, came back, had the biopsy, and the surgeon who did the biopsy, he indicated to me that even though they hadn't sent it off for a pathology report yet, that he could tell by looking at the fluid that they had drained from it that chances were that it was going to be cancerous. So I turned around and called a friend of mine. I used to do medical malpractice defense. And I called a friend of mine who did plaintiff's work, and I said, look, I've been diagnosed with breast cancer. I said, I'm not going to get treated here in the state. I want to go someplace that, does this routinely, that also offers opportunities to involve myself in the clinical programs, do anything I can to kind of pay back. And I said, do you know of anybody, any experts? Do you use any specific hospital? And he did. He had a pathologist, and told him what my concerns were, and I had the pathology report, and he was really, really nice, and he said, send it to me right now while we're talking. I sent him my pathology report. He reviewed it while we were on the telephone, line by line, answered all my questions. I was just amazed at the time that he would take. So he gave me Dr. Levine's number. I called Dr. Levine's office and got an appointment 2 weeks later and came straight in. Because they do the sort of round table discussion about patients, I got to see, Dr. Levine, the surgical oncologist. I got to see a medical oncologist, a radiation oncologist, a plastic surgeon, genetic counselor. I think there was one other person that I saw all in the same day, and one came into the room after another. All my questions were always answered. Even though I lived out of state, I could send emails. I'd get an immediate response, within just a few hours. I always felt like I was in very, very capable hands. Cancer's tough, and it takes a long time to be able to say the word and really to associate that word with something going on in your body. But, for me, because I'd always been so healthy and conscious about my health and doing all my mammograms and every appointment I needed to do, then to have cancer, it was sort of devastating. I wanted to go someplace to have questions answered. I wanted to go someplace that would let me make my decisions in regard to healthcare, but give me all the pros and cons, options, risks, but yet, still gently guide me in the way that it is with the information, not necessarily the decision-making process, because this was something I was going to have to live with in my life. It's really important for the patient to feel like they're a part of the decision-making process, not to just leave that up to somebody else.